All right, what's this? No tricks.
Look like basal.
Yeah, it's a basal cell. The reason that this one's kind of interesting is because it highlights a phenomenon that's in process here. That sometimes basals, we all know that basals have a cleft around them, which I always had taught was artifactual. Well, it turns out actually there is a mucin-filled cleft around a lot of basals in vivo, and they've used confocal microscopy to show that, which when I learned that, like, shattered my world. I was like, what? How is it true? But there also is probably some degree of artifactual separation. And that's what's happening here, is that that cleft has been widened during tissue processing, and the basal is kind of falling out away from that. There's also some cystic change in the middle of the basal. We can see that in basal sometimes. But this space here is widening, and the basal is falling away. But note that you can still see here the stroma, the spindly stroma. Tony Subtil, who's a great hempath, dermpath, he mentioned at a meeting once that the stroma of basal looks kind of like chubby neurofibroma cells. I hope I'm not taking his phrase too far out of context, but he said they look like neurofibroma cells but more plump, and I thought that's a beautiful visual explanation that I had never thought of, and I love it. So I think he's right. The stroma looks a little neurofibroma-esque, often with a little myxoid change. So the reason that this is important to recognize is because, look, sometimes you get a biopsy like this, where there's nothing, but there's a little space that looks like a cyst, and then there's some of that stroma around it, and you don't see any tumor. So when I see that, first I look around on the other sections, maybe do a deeper, see is there basal around here. But if you don't see the basal, I would still, with that, I would say this is suggestive of a basal cell that has become detached during processing and fallen out of the section. So even just this alone has such a distinct look that we know there must have been a basal cell there. And for treatment purposes, they should treat this like a basal cell. But usually I would say I get lucky and I find an area that has some basal still left, or a little bit of basal elsewhere on the slide. But it's a nice little trick to know about because it happens from time to time. So